Good afternoon, everyone. Thank you all for joining. So this session, we do have Dr. Liz Hanie, who serves as the Pre-Health Professions Advisor, and she will be talking about job shadowing best practices. You have the floor.
All right, thank you so much. Let me get my slides up. All right, can somebody give me a thumbs up? You can see. All right, thank you all. Appreciate it. Well, hey everybody, and thank you for the introduction. I am Dr. Hanie. I am the Director of Pre-Health Advising for the university, and finishing out my 19th year of pre-health advising here at Charlotte. So, and I've been asked to talk to you guys today about job shadowing and best practices. And so let me, there we go. All right. So let me just give you a little kind of background and rationale. And really, when we're talking about shadowing, shadowing is one type of experience that comes under the big heading of clinical exposure. And clinical exposure means observing the practice of whatever your target is, observing the practice of dentistry by dentists, observing the practice of optometry by optometrists. And so this is something that is expected by all professional schools. They expect that you've had enough exposure to the profession to know what you're getting into before you ever submit an application to professional school. Professional school is not about figuring out what you want to do. They expect that you've already have all the information you need to confirm that profession X is for you. So it's expected by all schools, and some schools actually require it. We'll talk about that a little later. So here are a bunch of reasons why they really insist that you do this. To get a reality check. Every profession has pros and cons. There's no profession, no job on the planet that's a total bed of roses. And if somebody applies to professional school, it makes it sound like the profession is all good. There's nothing bad or difficult, hard, challenging about it. The professional school will typically think that the student probably doesn't have enough clinical exposure. So they really want you to be realistic about what you're getting into. And also know pretty much as best you can what's required to be a practitioner in the profession and what's expected of professionals and what makes a good professional and what makes a great professional. They want you to confirm that the profession is going to be a wonderful fit for your future as best as you possibly can before you apply. And then every time you apply to a school, they are all going to ask you this question: why do you want to do this? So why do you want to be a doctor? Why do you want to be a PA? Why do you want to be a genetic counselor? So you're always going to have to answer that question. Sometimes you get that question on the application itself, and it's a written response. Sometimes you get this in an interview. And for a lot of schools, you get it in both places. You'll have to write an essay about why you want to do this and also answer that question in an interview. So you can count on that question when you finally apply to professional school. And it's pretty hard to give a very thoughtful reasoned answer to that question if you haven't spent much time around the profession. So those are reasons why schools expect that you do this. There actually, as I mentioned earlier, that shadowing is one way to get clinical exposure. There actually are other ways to watch professionals practicing their healthcare profession. So shadowing is one way. And then there are some volunteer experiences that you might participate in where professionals are involved in the volunteer experience. For example, if you're a pre-med and you volunteer, or even pre-PA, if you volunteer at a free clinic or shelter clinic or community clinic, there usually are going to be doctors and PAs involved in the clinical care of patients in those facilities. So you might be volunteering in the clinical area of a free clinic and working side by with PAs and physicians. So you're volunteering, but you're observing what they're doing in that setting. So that's another way some students get clinical exposure. And then paid employment, working with professionals. And the majority of pre-health students don't have a paid job in their profession. But we do have situations where we have quite a few pre-meds these days who get a CNA or EMT certification. I occasionally have pre-dental students that get a dental assisting certification. And so some students do pursue those certifications so that they can get a job working in the field. And so for a small number of students, they'll get their clinical exposure that way. So you have a CNA and you're working in a doctor's office and observing the practice of medicine while you're there on the job. There are different ways to get it. Today, though, we're talking about shadowing specifically, and so let's kind of turn our attention in that direction. So shadowing, what it means is directly observing professionals at work. Don't get confused, because in some professions, they actually don't call it shadowing, they call it observation. So for instance, if you're pre-physical therapy or pre-occupational therapy and you go to school websites or you're filling out the application, they don't call it shadowing, they call it observation, and they require observation hours. It's the same thing. Observation and shadowing are exactly the same thing. So they want you to watch professionals practicing their healthcare profession. We have two formats now. Pre-pandemic, there was really only one format for shadowing, and everybody did it in person. And then the pandemic hit, and we had schools had to acknowledge that there was no in-person shadowing for basically a 2-year period from the start of the pandemic. There was nothing. And so as an alternative to in-person shadowing, a number of practitioners and groups and organizations started creating virtual shadowing online. And most often this was YouTube videos or Zoom sessions where a doctor, say, would give a case study and how he or she worked it up and made the diagnosis and what the treatment would be. So those type of things popped up online. You can still find virtual shadowing, but my advice to you would be you cannot rely now on virtual shadowing as your only shadowing. Professional schools acknowledge that it's there and that you can learn from it. And if you do virtual shadowing, we would definitely put that on your application to professional school. But it can't be viewed as a substitute for in-person clinical exposure, in-person shadowing. So it's fine if you do it, but you need to be sure that you have in-person shadowing to go along with it. So as I mentioned earlier, there are some professional schools that actually require shadowing / observation hours, and they'll give you a specific number of hours that you must have as a minimum to even apply to their school. Requiring shadowing is more common in some professions than others. For instance, with medical school these days, very few medical schools have a requirement for a certain number of hours of shadowing. It's very unusual. Now, they absolutely expect clinical exposure, and nobody gets into medical school without clinical exposure, but they don't usually require, 30, 50 hours of shadowing. It's very unusual these days to find medical schools with that as a requirement. It exists, but it's very uncommon these days. Whereas for, say, physical therapy and occupational therapy, most of those schools require a minimum number of hours, and that the minimum number of hours will range from 50 to 100 for most schools, and that's a minimum to apply to the school. So they're going to be sure that you do it by making a requirement. So this information about what schools do or don't require is no mystery. You can find it on every single website of every professional school out there. So I really encourage you strongly to start getting used to, if you're not already used to it, going to the websites of the professional schools you're interested in and read about the prerequisites, read about the GPA and possibly admissions test requirements, read about the process they want in letters, and check other requirements such as shadowing or observation hour minimums. If a school requires these hours, there will also be a deadline by which you have to complete them. And that deadline is typically tied to your application year. So school may say, we require 40 hours of shadowing, and you have to complete this by October 15th of the year in which you're applying to professional school. Or the deadline might be December 31st, or it might be September 1st. It might be the following April before you would matriculate, but all schools will put a deadline, a specific date by which you have to at least have hit the minimum number of shadowing hours. So how do you find it? And this is kind of the holy grail, so to speak. I hate to disappoint anybody. I do not have a magic bullet to answer this question. Shadowing, 20 years ago was not that hard to find, and it got progressively harder. Before the pandemic even hit, it got quite hard to shadow. And then the pandemic hit, and now it's gotten even harder. But I assure you that we do have students now who are shadowing, and I'll kind of tell you where they have found the opportunities. So it's not easy to find it. You may have to kind of quote, knock on a lot of doors before you find somebody who's willing and able to let you shadow. So, and here's kind of the first thing I do want to emphasize is that there are some facilities, some offices and hospitals and clinics that just have a flat policy. Nobody can shadow in our facilities. And even though the doctors and practitioners in the hospital may love to have you shadow, they can't, because the policy in that facility is that there's no shadowing. Conversely, there are some facilities that allow shadowing, but there may be individual practitioners in that facility that just really don't want students hanging on their coattails. They think that they're, you know, too busy and don't have time, and et cetera, et cetera. So there are some professionals that just don't want students shadowing them, and that's their prerogative, right? And then it is true that some professions are more difficult to shadow than others. Some professions like dentistry, physical and occupational therapy, many of those clinics and offices are privately owned, and so the owners can make any rules they want for shadowing, and many of them actually are receptive to shadowing. But other facilities, especially if they're owned by a big healthcare corporation, often are not very receptive to shadowing. Either don't allow it in any of their facilities, or make it very difficult for you to shadow in their facilities. So this is kind of as a starting point, just please realize these things. So I can give you some recommendations, strategies, tactics, whatever you want to call them, that may be helpful in your search for shadowing. Some students actually have family members, and they have an aunt that's a dentist, or you know, a cousin who is a pharmacist, those type of things. So you know, if you don't have that in your family, you or your parents may know neighbors or friends of the family. You know, maybe one of your maybe have a parent who works in an office, and they have a friend in the office, and that friend has somebody in their family. I mean, it can get kind of crazy. But a number of students do have connections to people kind of around their world and their family's world who are in healthcare, and sometimes they can be very helpful in giving you a name or suggest calling, you know, clinic or office X for shadowing possibilities. So definitely leverage that if you have access to it. Some students start a volunteer activity in healthcare, such as a free clinic. If you're pre-dental, we have the North Carolina MOM clinics, and MOM is an acronym. It stands for Missions of Mercy, so we just call them MOM clinics. But we have pre-dentals who volunteer for the MOM clinics, and if you volunteer in a MOM clinic, you usually are going to be working alongside dental professionals, so you get to see the practice of dentistry there during this volunteer activity. So some students start these activities, and while they're in the volunteer activity, they get to know the professional, and kind of cultivate that relationship, strike up a conversation, and then ultimately, when it's comfortable, ask them about the possibility of shadowing back at the professional's home clinic. Most professionals who volunteer actually have kind of their regular practice, and then they're volunteering these hours on top of that. So most physicians in a free clinic, most dentists at the MOM clinics, they have home offices and home clinics where they spend most of their practice. So you can sometimes navigate to shadowing this way. If you're on my pre-health listserv, and you get all the different emails about programs and schools and speakers and clubs, I do send out a fair number of summer program announcements, and actually quite a few of them include shadowing experiences as part of the summer program. There also are companies and organizations, and I occasionally send these out as well on the listserv, but there are some companies and organizations that provide shadowing opportunities in other countries. Couple of words of advice about this, if you're tempted to go. Some of these companies are taking students to other countries and letting them do much more than just shadow. And they're letting them do things in other countries that would be completely illegal in the US. I would advise you to be very, very careful about choosing to go on a trip with those companies. Other companies take students to other countries, and they are very ethical in what they allow students to do. And so those are the organizations I would look for. Professional schools do not object to you shadowing in other countries. It's perfectly acceptable to them. But it's kind of like virtual shadowing. It cannot be seen as a substitute for in-person shadowing in the US. So they expect you, if you're going to apply to a US professional school, that you've had exposure to the healthcare system in the US. So you can't use this as a full substitute for shadowing here in this country. So yeah, just be sure that you check out the companies that you want to travel with, and be sure they're not letting people do things like extract teeth and deliver babies, which actually there are companies that do that stuff. One other thing I want to point out about these international shadowing trips: nobody gets extra points on their admission score when they apply to professional school for having done one of these trips. And the reason why is because these trips usually are really very expensive to take. And if a medical, a PA, or these other school, whatever school we're talking about, if they gave people extra points for doing this, they're basically giving points to people who have enough money to afford the trips, and that wouldn't be fair to an awful lot of applicants. So nobody gets extra, brownie points on their application score. So if you do this, do it for yourself, for your knowledge, expand your horizons. You will learn a lot. But don't do it as something you think is going to be a whiz-bang for your application, because the admissions committees will not see it that way. So finding places to shadow, kind of back to this original question here. My advice to students coming out of the pandemic has been twofold. I've suggested to students to look for offices, clinics, facilities that are privately owned and not owned by large healthcare corporations, such as Atrium Health, Novant Health, Caramont Health. So look for facilities that are privately owned. Now, there is no way to Google search, privately owned healthcare facilities. So that's not something that you can really do. But as you're looking at facilities online, if you see the logo for a healthcare system, Iredell Health, Caramont, Atrium, Novant, et cetera, it's going to be very difficult to impossible to shadow in those facilities. So I would say if you don't see that logo on the website, or you're driving by a facility and you don't see the big logo out on the building or on a sign in front of the building, that probably indicates that they are privately owned, or a small group. It's a one-person practice, a two-person practice, a 125-person practice. But they're not owned by a giant healthcare corporation. So again, they control their own rules about shadowing, and the students are having more success in these facilities than in the large corporate-owned facilities. The other piece of advice I've been giving students is to consider, if you can, look for facilities outside of the Charlotte metro area. And sometimes, this is not always true, definitely not always true, but sometimes the rules and policies can be a little more relaxed in some of these facilities. It's also something different to have on your application to professional school. I shadowed a family medicine doctor in this little town in Western North Carolina, as an example. So exposure to kind of rural healthcare where there's not like the Ivory Tower Hospital with everything, all the shelves are stocked and everything is paid for magically. There's a whole different side of healthcare in this country, and shadowing that and seeing that and understanding what's required of those practitioners and how they provide for those patients can be very, very eye-opening, and will contribute to your knowledge base about your profession. Another question that I get from students very commonly, or sometimes as a complaint, about I can't find hospital shadowing. And I will tell you that's probably the hardest shadowing of all to find. And the good news for you guys is it's not required. I've never seen any professional school that required hospital shadowing. So if you can get it, great. But if you can't, don't worry about it. I promise you, it's not expected and it's not required. So for our students who are currently shadowing, the large majority of them are in privately owned clinics, offices, facilities, and most of them are the fringes or further out from Charlotte Metro. So, but we definitely have students that are shadowing. So when you go to look for shadowing, you can use a direct approach. That's how most students have to do this. You find a facility or a practitioner, and now you need to make your approach to that person or the office manager with your request to shadow. So how do you go about that? And in my mind, there are really 4 ways to do this, to make that direct approach. You can send a cover letter and resume by email, and the email itself is serving as the cover letter. You can take the cover letter and resume and send them in good old U.S. Postal Service snail mail. You can call the clinic, the office, the practice, and ask about shadowing that way. And you can also go in person to practices. And if you do this, I would recommend taking your cover letter and resume with you. In case nobody can speak with you, you can hand them to the person at the desk and drop them off, and hopefully that they direct your cover letter resume to the proper person to hopefully get back in touch with you. So these are the 4 methods that I see if you're going to make a direct approach. If you're going to use a cover letter and resume, no matter If you're going to email it, mail it, drop it off in person, however you're going to do it. Just a few things about the cover letter. Be sure that you use a proper salutation, hello, or, those type of salutations. It should be fairly formal. You don't know these people. They're not your friends. So you don't want to say like, hi, or hey there. And be sure that there's a person's name or at least the name of the facility in that salutation. Emails that just say stuff like hello, and then dive right into the email, how are you? Dive right into the email, hey, are not going to go anywhere in this particular very professional world. So be sure that you have a proper salutation. Introduce yourself professionally in the cover letter. I am so-and-so. I'm a junior biology major at UNC Charlotte. And then you tell why you're interested in shadowing them. And this is another point I want to drive home. A letter that just says, I'm looking for shadowing, or my schools require me to do shadowing, is not going to go anywhere. So you really need to kind of tailor this cover letter for the type of practice that you want to shadow in. So say something about that. Maybe this is an endocrinology office, and then you can say something about, I'm really interested in learning more about endocrinology. Maybe even have a connection to endocrinology. You might say, I have a parent who's been a patient in endocrinology, or I'm a patient in endocrinology. But give them something to show a little enthusiasm for exactly what they do. If it's a physical therapy, occupational therapy, outpatient rehab clinic, maybe what you say in there is something along the lines of, I'm really anxious to see what the outpatient rehabilitation environment is like. So to just say something to connect yourself to them without just making it a generic, hey, I want to shadow you kind of letter. If you have shadowed other professions, mention it in the cover letter, because this lets them know that you are likely to kind of know how to conduct yourself when in this shadowing situation, and that will be helpful to them to know that you're not, that you have a little experience with this. And never make specific requests at this point of things. Never ask them, I would like to have 20 hours. My school says I need 50 hours, or I'm only available on Thursdays. Don't put any qualifiers, requirements on it from your side. You're just trying to get the yes, you can shadow me answer. So just ask for that opportunity. And then if you get the yes, then you and that practitioner or facility will work together to identify when you can and cannot come and observe. And the other thing I want to emphasize here too is never just like ask for an internship. You will frighten people because most practitioners, if you ask for an internship, they're going to think one of two things or both of these things. One, that you want a paycheck, you want a paid internship. And most of these facilities are not going to be able to pay you to do this. Also, an internship done properly is supposed to be a very educational experience. And in other words, not just like going through my day and not showing you anything. I'm actually a horse surgeon, that's my background. But in an internship situation, I would work out the case. I might be asking you questions while we work things up. When we're done with the case, I might just kind of pull you aside for 5-10 minutes and talk about the case, read films together, do those type of things. And a lot of practitioners these days just feel that they don't have the time to make this one of those kind of intense mentoring type of educational experiences. So that's why I suggest you not ask for an internship unless you're in a major where an internship is required, and that would be okay in that circumstance to ask for an internship. But if unless it's required by your major or part of your curriculum, I would strongly suggest not asking for an internship. Just ask for shadowing or the ability to observe them. You just want to get the yes and get your foot in the door. With your resume, certainly the Career Center is a great resource to help you with your resumes. But I do want, in this particular circumstance, to emphasize several things. Be sure to move, well, back up here. Resumes, depending on what you're using a resume for, you usually have to kind of alter positions and section titles and their order on the resume, an order of importance to the person who's going to be reading the resume. So education always goes first. So after the education section, I would recommend, if you have it, have a section and call it, dentist shadowing, physician shadowing, or you can just generically call it healthcare related experience. And maybe any shadowing, any volunteering, healthcare volunteering, but put all that should be your next section so that the recipient, these practitioners, know that you've had some exposure to healthcare and healthcare environments. Be very sure that your contact information is professional and not something silly like North Carolina Giggles. I actually had a student who did that on a professional school application, not with Giggles, but something not too dissimilar from that. And also be very sure that your voicemail greeting is professional, because if they get your cover letter and resume and somebody calls you on the phone and they get the voicemail and it's not very professional, that will be the end of your shadowing opportunity right there. And I do have some horror stories about that. So please be sure your phone number will typically be on your resume. Be sure that that voicemail is cleaned up and ready to go for these professionals who may call you about shadowing. If you decide to use regular U.S. Postal Service mail, my suggestion here on the envelope, be very sure that you put somebody's name. If you just send it to Houston Rehabilitation Clinic, it's going to go to a secretary or an administrative assistant of some variety, and they may just chuck it in the garbage. So by putting somebody's name on it, they have to then be sure that the envelope gets to that person. So do try to include a person's name. If you decide to use phone calling, definitely introduce yourself professionally, just as I mentioned for your cover letter. Introduce yourself first, and then ask about the possibility of shadowing in the clinic, practice, and office. So of these 4 methods, cover letter, email, cover letter, resume, email, regular mail, phone call, and this next one, which is going in person, there really is no clear winner here. I've never, in all my years of doing this advising, I've never felt that any one of these methods was far superior to any of the others. So I wish I could tell you, yeah, this is definitely the way to go, but I just can't. It seems to be a little bit too random, hit or miss, as far as student success with these different methods. So the 4th and final method is to go in person to the facility. And if you do this, I would certainly encourage you to dress nicely, business casual at least. Have your cover letter and resume with you, so that if nobody's available to speak with you right then, you can drop them off at the desk. Ask if that's okay. Well, may I leave my cover letter and resume with you then? And if nobody has called you in about 5 to 7 days, it would be appropriate at that time then to call them up and follow up on your cover letter and resume that you left off at the practice. There are some facilities out there that do have extra requirements. They'll say, sure, you can shadow, but you have to have liability insurance, and the facility is not paying for that. That's going to be on the student. Or if it's a curricular activity, the university might be paying for it if it's part of your curriculum. Some facilities will say, yeah, you can shadow here, but it has to be part of a course you're taking, a class you're taking. And the reason why they ask for that is so that there could be faculty or staff oversight of the student. And if they have any issues or problems, they can go back to that faculty or staff member and hopefully have it taken care of. So if you run into these, having to buy liability insurance coverage or academic credit for shadowing, my suggestion would be to contact the University Career Center, and maybe one of our hosts today might want to hop on and speak about this in a minute, about what they may be able to provide. But there's a possibility, at least, of being able to help you with these things. So kind of to wrap up here, I would like to kind of talk about some shadowing best practices, and that could probably be about a 30-minute talk on its own. So you've done your due diligence, you've knocked on a lot of doors, and somebody has said, yes, you can shadow me. And so there's some basic things that you should know about proper behaviors in that practice. And first of all, whatever they tell you you need to do that. So we'll start there, and that kind of covers most of this stuff on the slide, but not all of it. So when you're in these environments, obviously you need to behave professionally. And again, that's a big topic it's by itself, but professional behavior will be absolutely expected of you while you're in the facility. You need to respect patient confidentiality. If you are in the room with the patient, when the patient is being examined, evaluated, they're giving their history and complaints and things like that, you will see and hear things that that may be surprising or may stick with you for various reasons. But what you learn in that room never leaves that room in an identifiable format. So for example, if you're out with friends and you're out having pizza and you're like, oh, when I was shadowing, the such and such facility, this Mrs. Wilson came in with this, and this. And so you never ever give any information that identifies the person, or even details that could be, somebody could say, oh, well, let's see, she said this and said this and this, and you put them all together and you can figure out who the person might have been. So that's always confidential. Now you could talk about it in a general format, without naming the person or any particulars that might line up to identify who that person might be or where they might live. But definitely respect patient confidentiality. What do you wear? You have to follow the facility's guidelines, and they will typically tell you, exactly what is and is not acceptable attire. So obviously you need to follow that to the T. What really plays well with these facilities and with these practitioners is if you show enthusiasm and an eagerness to learn. That goes a long way with practitioners. Turn off your phone while in the facility. I've had reports from practitioners of asking our students to leave and never come back because they couldn't stay off their phones. So my big advice would be just leave it in the car or somewhere. Don't bring it in the facility. But if you do bring it in the facility, turn it off at all times, unless maybe you're on a break and they say it's acceptable to have it on. But basically, off is what you want to do. Note taking, one of the reasons why you're shadowing is to learn. And so most students, when they shadow, will have a little notebook or notepad, something for them to take notes on. Always ask the practitioner if it's okay to take notes, and if it is appropriate, when is it appropriate? For instance, a lot of patients would not want you to be in the exam room writing stuff down while they're being examined by the physician or talking to the physician. So that's usually a no-no in the patient care area. There are some exceptions to that. It depends on the type of practice and the patient's circumstances, but always ask, can I take notes? And if they say, yes, you can, then, when is it appropriate for me to take notes? So in most cases, you'll want to exit the room, and when you're in the hallway or break room or whatever, make your notes then. Show initiative, help out when you can. Somebody dropped something, would you like for me to get that for you? Oh, I really need this report to go down the hall to the lab. I'll be glad to take that to the lab for you. Those type of offers, even if they say no, you're showing initiative and interest and enthusiasm. And that's another thing that goes a very long way with practitioners. And finally, when the shadowing experience is over, please always send a thank you note. That's something else that will be very appreciated. They've done you a huge favor by donating their time to you, their expertise to you, and opening their doors to you. And you really, really should say thank you for that opportunity. Finally, keep in mind that every professional school out there either requires or wants a letter from at least one professional that you have shadowed or spent significant time with. So if you're going to have to go back to one or more of these people you've shadowed for recommendation letters, you want to be very sure you've left a very favorable impression of you on them. So, and then that will be reflected in their letter. And people are honest when they write these letters. And if the student is leaned against a wall with their hands in their pockets and just kind of, and that's all they did, that'll be in the letter. So you want to be sure that you leave a great impression on these people, because they're going to be your very good friends when you finally apply to professional school. So that's all that I had from slides, and I think we have some time. Career Center folks, I'll throw it back to you.
Yes. Does anyone have any questions for Dr. Hanie? Thank you so much. This was really informative, especially informative for me as a coach. I really appreciate this information. Does anyone have any questions? Please feel free to unmute or put it in the chat. Here's a question.
Nobody? You let me off easy.
There's one in the chat. So when in our academic career should we begin shadowing? So what's a timeline for shadowing?
My advice would be as soon as possible. for a couple of reasons. You want to start building an experience profile as soon as possible. Never at the expense of your classes and your grades, but I would recommend, starting to shadow as soon as you have time to do it. That's probably a good way to answer it. And realize that, depending on the profession, you may need to have at least 100 hours, 50 hours, 100 hours, by the time you are submitting your application. So if you are trying to graduate from Charlotte, say a May graduation, and go immediately into professional school that summer or fall, remember that you're going to be applying in the summer of the year before, the summer between junior and senior year. So you need to build a competitive experience profile by the time you apply in that summer between junior and senior year. So it's never too early, but again, never at the expense of your grades and your classes. So that's how I look at it, is kind of when are you planning to apply to professional school, and then how much time do you need to build that profile? For something like dentistry, I usually recommend that students should in a perfect world, you'd have at least 100 hours by the time you submit your application, 100 hours of shadowing dentists, observing dentists. There are professional schools, again, PT, and occupational therapy that sometimes require 100 hours of shadowing by the time you submit your application. So never too early, but do it when you have time. And this is something that accumulates over time. You might have a practitioner you can shadow just over the summer. And even if you went, 1 day a week during the summer, you'd have 80, 100 hours by the end of the summer. And some practitioners may only offer you 4 hours a week. You can come every Thursday afternoon, from 1 to 5. But again, if you're able to do that repetitively, those hours really stack up usually by the time you apply. And if somebody just says, you can shadow me, but you can only come 1 day, grab it. It's gold. Any shadowing you can get, even if it's a half day or 1 day, and that's all they're going to offer you, it is gold. So never walk away from that offer, because it's just so darn hard to find. So it's all good. So I also want to mention that, just for anybody who may not have done the orientations to their pre-health tracks yet, you are not required to graduate in May and go directly into professional school. That's not required. Many students need an extra year, sometimes two, to be fully ready to apply to professional school. And actually for medical school these days, we're almost 75%, 73.2% of students entering medical school have taken at least 1 gap year between graduating from college and starting medical school. So I didn't mean to with my example, I didn't mean to leave the impression that you had to do that. Graduate in May and go right in. So there are a lot of options for getting into professional school as far as timeline options. But yeah, if the tightest timeline would be applying between junior and senior year in that summer, so that you could graduate in May and go right in. So if you're finishing up freshman year and that's the timeline you want to follow, you have basically about 2 years. You have sophomore and junior year in front of you to gather those hours. So I hope that's answered your question. If not, please put some more information. Oh, there's more information here. Should we shout at multiple places, or is one more beneficial? That's a great question. And most professional schools will value some diversity in your shadowing. And by diversity, I mean seeing different practitioners, different facilities, different specialties. So there is definitely a benefit to seeing more than one person and more than one facility. Having a lengthy relationship with one practitioner is going to pay big dividends, because short-term shadowing, you're going to get a little snapshot of what that practice is like and what their day is like. And, so a long-term relationship where you can see the practitioner over and over, you're going to get a more, I think, thorough impression, and probably a little bit more realistic impression of what life as a fill-in-the-blank doctor, dentist, optometrist, pharmacist is like. Are any of you guys pre-pharmacy, by the way? Anybody? Pop it in chat if you are. I'll make a special comment about that, and if not, we'll just leave that alone. The other thing about having a long-term shadow relationship with one person is, again, the more time you spend with somebody, usually the better and better their recommendation letters get, because they'll have more to say based on a longer time of knowing you. There's no magic number of hours, by the way, to spend with a practitioner before asking them for a recommendation letter. My rule of thumb is you probably should spend about 24, 25 hours with a practitioner. That's probably enough time to ask for a letter of recommendation. 20 hours probably be the bare minimum, but to shadow someone for a day or two, 15, 16 hours and ask for a letter is probably just not enough time to really be a good ask. But shadowing at multiple places, I would encourage that if you have that luxury. And again, professional schools understand the environment of shadowing. They understand how hard it is. We used to have a lot more schools that required shadowing, and we just don't see that these days as far as a requirement, because they know how hard it is. And so if you're in a profession that's difficult to shadow and you only have one shadow experience, for most schools, that's going to be sufficient. As long as you have, again, when you add up all your clinical exposure, shadowing, exposure through possibly volunteering, exposure possibly through a job, as long as that you've done enough that they feel that you've seen enough and learned enough, that can be enough. One practitioner can be enough. But I can tell you for sure that there are admissions committees that will appreciate some diversity in your shadowing. And again, diversity comes by seeing different locations, different settings, different patient populations, and different specialties. And every practitioner you shadow will have a location, a specialty, and a patient population. So yes, if you can move the needle a little bit, that's great. But these days, it's very hard to have a lot of shadowing. So, and again, and never forget that there are other ways to get the clinical exposure. But if they rigidly require shadowing, you're going to have to find it. Anything else, guys? Okay, if you have any questions for my office, you can reach us through email at prehealth@charlotte.edu, and just write prehealth as one word without any punctuation, prehealth@charlotte.edu, and we'll be glad to assist you.
Well, thank you so much, Dr. Hanie. Everyone, this will be available on YouTube if you want to refer back to it or share it with a friend.
Thank y'all. Appreciate it. Thank you for your time.
Have a
Thanks,
good day,
Liz.
everyone.
Bye.